going to say good morning to everyone. My name is Carol Burnett. I'm the director of the Mississippi Low-Income Child Care Initiative. I'd like to welcome you to this webinar. Today, we're very pleased to have Christy McHale, who is the Early Childhood Care and Development Division Director at DHS, and Chad Allgood, who is the Deputy Director of the Division of Early Childhood Care and Development at DHS. The topic of today's webinar is the new emergency child care sites. You probably heard Governor Tate Reeves announce last week in one of his COVID-19 update news press conferences that there has been an emergency child care site announcement, and DHS is making those available. And we've been joined by Andrea Sanders, General Counsel at the Department of Human Services. Andrea, glad to have you here with us as well. We're going to take some time this morning to hear from DHS about these emergency child care sites. Let me just say before we get started that those of us at the Child Care Initiative rushing to try to be right on top of everything sent out an email that said they were early childhood grants. They are not. It's an early childhood emergency site designation. But Andrea, Chad, and Christy are going to give us a lot of information about what that means, what it means for child care centers, what it means for child care centers that have been participating in the child care payment program. If you have questions, if you will type them into the Q&A part of your screen on this Zoom platform, I will get to as many questions as I can today. Also, I want to let you know that on our website, mschildcare.org, we are posting the recordings of all of the webinars that we've been having with additional information, including the information and the link to information that DHS has made available about these emergency child care sites. So without further delay, I would like to turn it over to DHS so that they can give us an introduction, and then we'll get to your questions after they're finished. So Christy, I guess I'll turn it over to you.
Thank you so much, Carol. Thank y'all again for giving us a platform another platform to talk to our providers today. I know everyone is wanting to learn more about what we call the CCAIR sites. It's the Child Care Assistance and Isolation Response Plan. Part of that plan was announced through the governor's press conference last week. The biggest question that we tend to get, and that's kind of the first thing I want to talk about today, is the difference between a CCAIR site, which is an emergency temporary site, and what being CCAIR trained means. So a CCAIR site is the solution and model that we've offered to the state if you have an area that needs basically emergency pop-up childcare. We know that in this time, many centers have either had to close their doors or chosen to stop the spread of COVID by closing doors, and we understand that. There is still a need for those that work in the healthcare industry and the first responders to have their children cared for when they don't have other options. So this model is an offering that we're giving that we work with health on to allow for emergency sites. Now, if you're the people that are watching this right now, the current child care providers, you do not need to apply to be a temporary site. You already have a license to operate as a child care facility. So this would not apply to you. You don't have to be a site. The other side of this is what we've created, which is a lot of people have been asking for, what can we do if we want to open? How do we remain open safely? So there are best practices that we've pulled. We've looked at CDC. We've asked some of our specialists around the country. You know, we've looked at a lot of material and pulled together sort of some guidelines that allow you to be CCAIR trained. And we really encourage everyone, whether you're open or closed, to go ahead and get that training so that you can go ahead and put in some safeguards when you do decide to open. For the question about emergency certificates, you know, they also announced we're going to be doing emergency certificates starting this Wednesday. We're going to open that up. For the people that are getting those emergency certificates, those children, we're going to prioritize sending them to the CCAIR trained sites for providers and allow them to also go to the CCAIR sites themselves, the temporary emergency sites. So that's the primary sort of overview of how the CCAIR plan works. If y'all want to add anything? No?
No, just to say that, you know, as a reminder, our all of this was developed with, I would like to say, first of all, with a lot of work and numerous hours by both Christy and Chad and a few other staff that they pulled together as a skeleton crew. Most of our staff are working from home, still working applications for parents every day. But these guys really, they put a ton of work into this. And if you look at the materials, I think it's obvious. But the two goals that we are really trying to target through this plan are, we want to do everything that we can to stabilize the existing child care workforce so that it is still viable and ready when the economy starts to open back up, when we start to ease off of the restrictions of the social distancing restrictions. But the other side of it is that we also recognize that we need to build capacity to address immediate needs, primarily healthcare and first responder needs. And so we're trying to balance those two competing goals with the funding that we have available. So I would just keep that framework in mind when you're evaluating what it is that we've done and what we have to offer you.
Christy, let me just clarify. You said that the current child care payment program, child care centers don't have to apply. But if they wanted to take emergency vouchers, do they have to go through the training to be designated an emergency site?
Yes, so yes, you do have to be CCAIR trained. If you're a current provider, you could not become a CCAIR temporary emergency site. That is just a long fancy word for a pop-up site, an emergency site. You're already a child care provider. But if you want to be eligible to take emergency certificates, then you would need to be a CCAIR trained site. And so that is why we have the free online training. If you go to mdhs.ms.gov/CCAIR, CCAIR, you can go there and there's a link that says how to be CCAIR trained. You click on that and it has the 4 steps to getting into and logging into that. You'll get a certificate at the end. If you will just email that certificate to us, we will designate you as a CCAIR trained site. And whenever that, it's just like other certificates, when they go in to pick their site, they would be able to select you as their site that they could go into and become, you know, if you have a vacancy for there.
The CCAIR training is one component of becoming a pop-up site, a CCAIR site, emergency site. The rest of becoming a pop-up site has to do with navigating regulatory requirements, like we know that they can't necessarily, you couldn't necessarily get a pop-up site licensed quickly enough and through all of the usual regulatory requirements. So it offers an abridged path that some centers can take that we will help them navigate. But our centers are already either licensed or registered and meet those requirements. So the training is something that is additional for both the pop-up sites and for our providers, but it is the designation that would allow them to accept these temporary emergency certificates.
And there were additional requirements as I read the manual for drop-off and pickup, for a sick room, for ratio and group size. So there are a number of things that are unique to the emergency sites. And I'm assuming that what you're saying is that if the child care payment program site wanted to take an emergency certificate, they would have to comply with those as well, correct?
That's correct.
Yes, and those are all the guidelines that came from the CDC and the Department of Health. And that information has been available since pretty much we first got our CCAIR updates going on the CCAIR webpage. So it's been out there, and all those precautions are designed so that any existing child care facility that wants to operate as a CCAIR trained site it helps them put protocols in place to protect not only the children that they're caring for, but also themselves and their staff.
All right.
So that training is required to accept those emergency certificates, but it is optional right now. A child care provider can choose not to complete the training, but I would suggest that it's just a really good idea as well. Everyone is concerned about spreading this virus and concerned about being able to, we've heard from a number of providers who are concerned about how they can continue to remain open safely. And there are no guarantees during this pandemic, but what we've attempted to do is consolidate in a useful, brief piece of information what best practices are out there, what we think will help the most.
Can you speak to who qualifies as an essential worker for one of these emergency certificates? Because a lot of the Child Care Payment Program recipients that qualify for Child Care Payment Program certificates who are low-wage workers at Walmart or in grocery stores are considered essential workers, but they weren't on the list that I saw. So could you clarify who's eligible for an emergency certificate?
Yes, so what we've done is, for right now, we've gone with the most immediate need, we feel, which is going to be first responders and healthcare workers. So the list will be posted on our CCAIR COVID-19 website. If it's not already done, it will be later today. That request went in Friday when we sent everyone, hopefully everyone received their email from us. But it's an extensive list, but I'll be glad to read it off if you'd like, Carol.
That list was in the letter that you sent to Child Care Payment Program providers, so I'll refer people to that just for time-saving purposes.
Well, and we also put out, if you remember in the letter, part of what we put in the letter is that list may expand or contract depending on the needs. So we'll have a better sense of that once the certificate application process goes live next Wednesday. And once we kind of get a feel for that and how many CCAIR trained sites we have available, you know, that could change. But right now, the priority we felt was first responders and healthcare workers. That's been the largest request that we've received. So that's where we are with it right now.
Okay. We have a question about the emergency child care vouchers. Who can apply? How long will approval take? And how soon after approved will the site providing care be aware the voucher is approved?
Okay, so we'll start with the first part of that, which is anyone that's in the list of this priority population can apply. We, with our regular process, could take up to 60 days. Of course, these are being prioritized. So once we get into the process, we'll know better, but we hope to turn those around very quickly. What was the last two questions? I think you had a couple more in that.
It was the timeline for approval and the timeline the provider would know that the voucher is approved.
It would be just like our regular certificates. As soon as they're approved, as soon as it's approved in the system, the email goes out. The process is the same. So you will receive an email as soon as that certificate's approved.
As a reminder, our staff are primarily working from home, which is a challenge in and of itself. We don't know what the response will be to these certificates when we open them, and that is one reason we started with a little bit narrower population. Because let's face it, if we can't get the certificates out there in a timely manner, they really don't do what they're intended to do. So, you know, all of this is a bit of an experiment as we move forward. And our goal is to try to start small and do it well. But we're going to need your feedback on that. You know, if you're finding that, you know, that applications have been put in and you're not hearing anything back on them, we need to know that. Excuse me. As to the list of the workers that we classified as this priority population, you know, Christy said that we started narrow and we may expand it as we go. I would remind you that you know, folks, somebody who's stocking shelves at Walmart is still eligible to apply for a regular certificate. And generally, we think that most of those folks will qualify for regular certificates. We may be wrong. And so, again, that's why this sort of open dialogue you know, to get a sense of where the need is and whether or not we're meeting it is important.
There is a question about those parents who are already receiving child care assistance, such as the Walmart worker that you were just referencing. Is there a chance for the payments for those children to be a higher reimbursement rate as well?
We do not intend to change the payments on existing child care certificates. We've committed to paying for those certificates whether or not the child attends. So we're paying for a number of children not to go to daycare right now or child care. And additionally, you know, again, it's that balancing of a long-term commitment to sustaining the child care workforce versus meeting immediate needs. And so we just made a decision that that's kind of a line in the sand. If we're going to have sufficient funding to keep keep paying for children who are not attending child care, we just felt like, you know, we're not going to shift certificates over to a different type. These are intended to meet the needs of children who are not currently receiving child care.
There's a question about getting an inspection to become an emergency child care site. How soon after the application is made can the site get an inspection scheduled?
So inspections are only for CCAIR sites. If you're an existing child care center and you've already got a license, or if you've already been registered with the Department of Health, there is not an additional inspection required. For CCAIR sites, these are again the emergency pop-up child care facilities. It's really just a matter of how quickly the site itself can get things going. Once the site has applied and it's ready, they'll be assigned a coach, a CCAIR coach, and that's through the early childhood academies. The coach will do an on-site visit with the site to get them ready for the inspection. Once the site has met those requirements, Department of Health will be notified to come in and do an on-site inspection. And that can happen, I mean, we have things in place to make that happen relatively quickly. So for new CCAIR sites, we're saying depending on how quickly the site itself moves, they could be ready in operation in, approximately a 2-week period.
There's a question about whether the emergency child care vouchers will require cooperation with child support.
Not this time.
Will child care employees be able to receive emergency vouchers for their own children?
Right now, it's limited to first responders and healthcare operations workers, so not child care.
Where do we email the certificates?
It goes to, hang on, let me make sure I tell you right. It's ccpayment@mdhs.ms.gov.
This provider says, I have done the training. Will an inspector need to come out before I can take the emergency vouchers?
If it's an existing child care facility that is already licensed or registered, then no. But if it is a pop-up emergency site, the facility will be inspected before the facility can begin operation. But existing child care centers that are already licensed or registered do not require an additional inspection.
All right. Are the emergency child care certificates without regard to income?
They are right now. Mm-hmm.
After enrolling, how long will the parents wait to receive those emergency certificates?
after enrolling, you mean after their application, after they submit an application?
Yes.
Yeah, okay. So again, this is a work in progress. We'll see. We are prioritizing that group. So we hope that it will be within, a couple of weeks, the most. Also, there has to be facilities out there to accept the children, which is why we put the training online last week to go ahead and get some of our providers ready to start being CCAIR trained.
Will there be a list of emergency child care sites that parents can refer to when they're looking for child care?
As far as specifically identifying emergency sites, right now there's just the child care search option, but I believe that
We're adding it, yeah, and I don't know exactly. I know we're testing it today, but part of what we would like to do is add a flag that, like, you can search for subsidy centers right now. We're going to add a CCAIR or emergency flag that will allow you to search for that subgroup. I don't know when that's going live. It should be soon, this week.
I think you spoke to this, but there are a couple of additional questions about what email to send the training certificate to.
Again, it's CC Payment, PAYMENT, at mdhs.ms.gov. That email is also, if you look in your letter that we sent Friday, it has the email there. It will also be on the training when you go to take your actual training, that there'll be a note there that tells you to put your certificate and send it to that email. So there's a couple of places you can find it.
All right. There is a provider that's stating that the additional staff required to keep the group size within the recommendation and the additional healthcare coordinator and mental health consultant are increasing operational costs. And so there's a question about where there's additional money to help pay for those costs in regular child care payment program centers.
So again, those specific positions are specific to CCAIR sites. So these are the pop-up centers. When you look at the descriptions of those positions, most of those positions are existing or fall within the realm of existing positions in a child care facility. For example, the CCAIR site coordinator would be like the child care director. And the child care director can double as more than one person. So if the director can also serve as the sanitation manager, and in many cases, like the director also functions as the food safety manager. So those types of positions are really were designed to, that they can be integrated into existing child care facilities as well. Now, the health consultant and the mental health consultant, those do not have to be people on site. If the child care facility wants to find someone that's in the healthcare field, it can be a physician, it can be a nurse, someone that can just respond to questions. That's not necessarily someone that's required to be on site. And again, all of the requirements that are in the CCAIR manual don't necessarily apply to existing licensed or registered child care facilities. Primarily what we want is the child care facilities that are licensed or registered to follow things like the screening process, the additional cleaning and sanitation, and then of course adhering to the group size. And in terms of the group size, it's really up to child care facilities if they want to follow that 10 group size or not. Now, I will say and stress that that is a recommendation that has been given by the health department and by the CDC. So following these guidelines, is going to be crucial to help stopping the spread of COVID-19. So while not required by licensed or registered facilities, it is strongly recommended.
We have some questions about whether there is a source for personal protective equipment for child care centers. And also along those lines, a question about whether the no-touch thermometers and the personal protective equipment can be available, made at no cost to providers who are trying to comply with those recommendations.
Yes, and we are in the same boat really as everybody else. I hate to say, we have requested some from MEMA. We are currently working with our partners to find vendors and people that can help us secure some PPE for our child care providers. We've been somewhat successful, and we hope to get some, maybe some masks. Again, the thermometers you're talking about, we have a few of those that we've secured, and we're working right now to gather what we can to then distribute to the centers that potentially will be CCAIR sites or CCAIR trained sites. So we are working on that. We do not have a source that I could offer. A lot of times, personal connections or business connections that people have been really valuable with this. I've heard from other groups. So I would just encourage you to do what we're doing, which is just to reach out to anyone you know and secure as many as you can. I know there are a lot of people out there that are sewing masks. So if you have a sewing club in your community or something like that, we would encourage you to email or reach out to them. I know some people have been successful. Here's Andrea's. I have mine upstairs. And so
It's both functional and fashionable.
That's right.
But really, I mean, I think that right now the current guidance is that there is a lot of value to just not, to having something over your face. We're working to try to secure goods, as Christy said, but we don't have a lot, and we have some promises of things that may come, or I wouldn't even go so far as to call it a promise right now. This seems to be a very slippery, elusive thing, but know that we are willing to use our buying power, and we are willing to leverage, resources, but what we're able to actually nail down right now is very, very limited.
And I do want to remind everyone, we sent a letter out or an email out, I want to say on the 15th, but anyway, it will be on the website today also. But our executive director, Bob Anderson, wrote a letter of support for child care providers requesting, it's basically a letter that you can show a potential supplier that says, please prioritize child care as essential personnel and consider potentially lifting your, a lot of them have limitations on what they'll give. And so maybe the letter will help, maybe it won't, we don't know. But it was just one more thing we thought we could offer child care providers to encourage people to allow them to purchase what they need to care for the children. So it'll also be linked on our website, so you can download it if you can't find your email.
Thank you. There's a question about the training to become an emergency child care site. Does the whole staff have to be trained, or can the center director take the training for the center?
Just the center director would be sufficient for that. And that training is good. You will receive a contact hour credit that can go towards your 15 required contact hours with licensure.
There were a couple of questions about directors that took the class and completed it but haven't received their certificate yet. What should they expect about how long it might take to receive that?
Unless they took it the very first day, they should. Well, even if they've taken it the first day, they should have received a certificate by now. If you have not received a certificate, I think there is an email on there. I'm trying to remember who it was to, Shaylin. Well, they could email me or Chad for that matter, and let us know if you did not receive your certificate and you went through the training. Now, one thing that some people were, I noticed have been happening lately is they don't take the quiz. You do have to take the quiz after you watch the training. And that's what gets you your certificate, because you have to pass that little test. So just a few questions just to make sure. So that has been the case with most people that have said that they did not get a certificate or weren't able to secure one. And I think they have reached out, and I know they're calling in today to a few people that either failed it or didn't finish, the whole course. And I know Chad said it's just for the site coordinator, and because they're the ones that, or in your case, the director, because they're the ones that are going to put all the safeguards probably in place. But we encourage everyone to take it. If you can get your staff, it's free, it doesn't cost anything. To have your staff, all your staff take it is only going to take about 30 minutes, is how long the training is. So, I'll leave it at that, but I do encourage everyone to take it.
All right. There's a question about the reimbursement rates. Are the rates the same for emergency certificates as for current child care payment program certificates?
The emergency certificates are going to be paid at the comprehensive rate, so they're going to be a little higher.
And what is the comprehensive rate?
Well, it's posted online, but I can tell you that so there are 8 groups. For full-time 0 to 12 months, it's $600. For 13 to 36 months, it's $600. 3 to 5-year-olds is $550. Summertime age, which is your 5 to 13-year-olds, is $500. And then special needs is $625. That's for the full-time. For the part-time rates, it's $300 for 0 to 12 months, $307.50 for the 13 to 36 months. 3 to 5 years is $282.20. And then for the 3 to 5-year-olds, hang on, I'm getting off my lines here. Here we go. 5 to 13-year-olds is $304.90. And then special needs is $325.38. I think I got them all right. But they're also going to be posted online, and they have been. They're part of our great summary.
Yeah, that would be helpful. That's a lot of numbers, so
yeah, well,
having them posted.
Right, they're online where the current standard rates are. They've been there for a year or more.
One question: when will the application process go live? I read tomorrow, and then Wednesday, and now next Wednesday.
No, it's this Wednesday.
Okay.
It goes live in 2 days.
And what is the site for essential workers to apply for an emergency child care certificate?
So they would go through the child care payment website, just like regular certificates, and there'll be an option there for emergency certificates.
And how is a person determined to be approved for an emergency certificate?
So it's just like a regular certificate where you go through a series of questions. Part of those questions include selecting you as a priority population. You would have to tell them what priority population you're in, and then go through the regular process like we normally would. It'll guide you through what things they need to submit.
But you indicated that income was not part of that, and child support was not part of that. So it's just the priority the occupation.
So it's like proof of age, proof of identity for the parents, proof of residency, and then proof of employment that you're an essential personnel. So those are the primary verifications that we look for that certificate, just for the emergency certificates.
And how long will the emergency certificates last for the person who is approved?
Initially, we're doing them for 90 days, and if we need to, for some reason, extend that, we will. But we're going to do that on a case-by-case basis. We don't know where this crisis is taking us. So we thought initially 90 days would be a good starting point, and then we'll reevaluate as we need
to. One provider says sometimes it takes up to 6 to 8 weeks to have a regular certificate approved. Will it take that amount of time for the emergency certificates as well?
No, it won't.
The requirements are greatly streamlined for that certificate, for one thing, which makes it a much simpler application process, a simpler review process, and so there are a lot of reasons to think that we can accomplish that.
One provider asks, do both parents have to be an essential employee or just one parent?
The parent that's applying for the application needs to be, not both.
All right, I'm going to some of these questions you've already answered. There's some questions about redetermination for regular child care payment program certificates. Can you tell us about the status of redetermination right now?
Sure. So we're encouraging those that can go through redetermination to go ahead and submit your application, your verification documents, and go ahead and get your certificate. You know, go through the redetermination process and get your new certificate. If you're not able to do that right now, we understand that that's not the case for everybody, but we've told that process and that we've extended those deadlines. We're not going to be cutting anyone's certificate off during this time. And then eventually, once we realize we're kind of at the end of the crisis, we'll give them a definite time period for which they'll have to get us all their information or they would have their certificate terminated. But right now, that's not the case. We're making sure that those certificates are staying active. Now, if they do have access to the information, again, we do go ahead and encourage them to complete that redetermination process.
Will that be based on the 60-day timeline?
So once we find a final date that we're going to determine, you know, we were in the clear, we feel like everyone can now go through the redetermination process fairly. That date, we'll send a letter out to everyone and say, okay, now you have 60 days to get everything in. So that's the plan for the redetermination.
So in anticipation that a lot of people will have difficulty meeting the work requirement right now. But as you can imagine, for those people who are meeting the work requirement, we will have a big load of redeterminations that come due all at one time. So for those who still meet the work requirement, it is infinitely better for them to go ahead and get that certificate and just take care of it right now. Additionally, you know, the benefit for folks going through redetermination for their existing certificate versus an emergency certificate of some sort is it's a 12-month certificate as, you know, required by the program. So we do hope that people will continue to submit their redetermination applications if they're able to meet the requirements right now.
There's a question about the payment based on enrollment versus attendance. Can you speak to, I think I saw that you've extended that through May.
We have, yes. So whether the child is attending or not right now, and whether your center is open or closed, if they're enrolled at your center, we will continue to pay that, and we've extended that through May.
Is there a limit to the number of children a pop-up site can accept?
Yeah, that you want to speak to that about inspection.
So as far as like the number that they can accept, it should be any, like if you're a CCAIR site, when you receive the inspection, it's 10 per group, per area, per room. And that will be determined, you know, when the CCAIR coach goes to visit and then when the inspector goes on site to the CCAIR site. That's for the emergency sites. For existing child care centers, because we're paying for, if children that are on subsidy, you should not fill a spot with an emergency certificate that's already being held with a spot with a certificate. I'm saying that right?
Yeah, so your emergency certificates at a site where you are now, they're meant for vacancies. So if you have room and you're based on your current license and you have spots that you have available and you're able to take an emergency certificate, we would encourage that. We understand a lot of children aren't attending right now, and the parents are choosing to keep them at home, which is, we understand. So we would ask that you stay to that group size of 10. That's the recommendation, and that's what we're looking for at the CCAIR trained sites.
So if you are a child care payment program center right now, and you have children of essential workers, are those parents eligible to get emergency certificates?
Not if they're already on a certificate. We are not interested in moving existing. We're trying to expand the amount of childcare we have available for everyone and also retain the ability to support paying for children who don't attend right now. So it is not our intention to move children from an existing child care certificate to an emergency certificate. While the rate might be higher for a brief period of time, it is a time-limited certificate. It's not for a year. So it would disrupt the very stability we're trying to bring into the system.
How long do you anticipate the emergency child care site program to last?
We really can't say at this point. It's until as long as the state of emergency remains in place for the state, CCAIR sites will be allowed to operate. We are trying to stay on top of any information as to when that state of emergency period may lapse, and as soon as we hear, that there's an anticipated date, we'll notify all CCAIR sites as soon as we hear.
How many child care centers have taken the training?
The last count I heard, but this was end of last week, about Thursday, it was over 100. So I don't know exactly, but I know we're well past 100 as of last Thursday morning when I had our call.
All right. Here's another question that you've already answered, but I think it would be helpful to repeat. Can you repeat what link parents should use to do the application for emergency vouchers? And again, that will be this Wednesday, right?
And it's not public, we haven't published it yet, it'll be Wednesday. So you can go to the regular child care site that you go to right now for certificates. Also, you can always go to the mdhs.ms.gov/CCAIR, CCAIR, and there'll be a link right there to the emergency certificate application portal.
Will the emergency certificates expire, or will they turn into regular certificates?
They'll expire after 90 days.
Unless we extend them, we'll evaluate that, but they are designed to expire after 90 days. Which is one of several reasons we do not want existing child care certificates to lapse and then move over to that emergency certificate just because the rate is higher. The higher rate is designed to incentivize folks to take them, to compensate for the upheaval to the existing system. We don't necessarily anticipate that every pop-up CCAIR site will even access those certificates. What we're finding is that there are hospitals or local community-based groups that are interested in sponsoring a CCAIR pop-up site, and they might provide that service just for their own hospital employees and absorb the cost of that. We're not trying to use CCDF funding to completely supplement that. This is more of a model, and we're providing navigators and expertise. And then if they're willing to set up to receive child care vouchers, they could receive these emergency vouchers, but not regular long-term vouchers, right? It's just the 90-day short-term emergency vouchers.
Can you give more detail about what qualifications a center staff person should have to be designated as the mental health consultant?
It really should be someone that's trained in behavioral health for children. Someone like a child psychologist, someone that is certified or licensed to provide mental health services to children. It could also be like an early interventionist. So again, someone it's that the certification would be the piece there that would qualify someone as a mental health consultant.
Will teachers and children have to wear masks inside the child care center?
I think that's really, to the discretion of the staff members at the child care centers. It is a very strong recommendation, especially in the morning if the facility is doing the screening process. Staff members that are, on that front line of accepting children, I do believe that it would be a good measure of safety and precaution to wear masks. If you have children that are displaying symptoms of illness during the day and they're excluded in a sick room or a room separate from other children and staff, those children have to be directly supervised. I would also strongly recommend that those staff members be given masks and gloves, personal protection equipment.
With regard to the sick room, does that requirement mean that each site will need at least one additional staff above the required ratio, given the requirement that a staff person must remain with a child who needs to be held there?
It really depends on the situation of the individual site. All we say is that children that are ill or display symptoms of illness do need to be excluded as soon as possible and will need to be supervised. Now, I would not advocate that these children that are showing signs of illness remain at the facility for the remainder of the day. Good practice in child care regarding exclusion of sick children is that you remove the child from other children and staff members that could be infected. You immediately contact parents or guardians to come get that child as soon as possible.
Is the total number of children in a group and children and staff still 10 or under, no matter how large your building is?
So again, those are the recommendations for CCAIR trained, the current child care facilities, because they are classified as essential businesses by the governor with his executive order 1463. They are not held to that group number. Now, CCAIR sites, these are the emergency sites that we'll be setting up, they are going to be held to that 10 or fewer group size requirement. Child care centers, it's up to their discretion whether they choose to follow the recommendations or not. However, bear in mind that the larger your group size and the more that those groups overlap, if you have intermingling between groups, different groups, children from different groups, you're exposing those children and staff members in the building to more potential, more potential contact. And the more contact you have with other individuals, you're likely increasing your chances of contracting the virus.
Can providers sign in and out regular certificate students so they don't have to come into the center?
Yes, that is one of the things with the CCAIR plan that we put in place. And that's another reason why being CCAIR trained as a child care center is so important, because in the regulations that child care centers are typically bound to, it requires that parents or guardians of children that are enrolled have access to the building at all times. Following the CCAIR plan, it allows that to be waived. And one of the things that we say is to help protect against the spread of that contagion, do not allow parents into the facility. Something else to bear in mind is parents that are on the front line, meaning those that are in the healthcare field, they're literally on the front line every single day and are more than coming into contact with potentially infected individuals. So it behooves any facility, whether it's a CCAIR site or a CCAIR trained child care or registered provider, to put these additional screening precautions, which includes not allowing those parents into the facility and doing that screening before the children actually come into the common areas where other children or staff are located.
Since school is out, will school-age children be reimbursed at a full-time rate?
I think they're switching that. I think you have to notify, go ahead.
Right, so if the child is attending, if the child is attending the facility and they are attending for the full day, then yes, they will be reimbursed at a full-time rate. Now, a school-age child that is not attending will be reimbursed at whatever rate they were before, which would be part-time. But if the child is attending and the child care facility is offering full-time care to that child, then yes, that school-age child can receive or will receive full day reimbursement.
Will the essential workers for the emergency child care certificates have to provide long form birth certificates or
Yes,
can a
they-
120?
Go
Sorry.
ahead. I cut you off before you finished. And immunizations,
Well,
is that what you
the
mean?
rest of that question was whether they needed to provide the long form birth certificate or whether a Form 121 could be used to verify the age of the child.
No, we're still going to require the long form birth certificate.
That long form birth certificate establishes paternity, Carol. It doesn't just establish the age of the child. We have to have proof of that it is the parent or guardian seeking the voucher.
Can a recipient of a regular child care payment program certificate move to an emergency certificate?
I think we've addressed that a couple of times, that right now, if you're under a certificate that's a regular certificate, that's where you would stay. So there's not a need for an emergency certificate.
No, and we discourage that because it will cause instability in the system, and because they will be moving to a certificate that is much shorter term in nature and will expire. So parents who already have a certificate need to keep that certificate and apply for redetermination if it's time for them to be redetermined, if they can meet the requirements right now. And if not, that will be, we will toll that redetermination deadline and give them a 60-day notice when they must reapply for that certificate.
Will an emergency child care site be paid based on enrollment or attendance?
Are you talking about these are the pop-up emergency sites?
I think this question was in the instance of a child care center that became an emergency site.
Okay, so a child care facility that is going to be accepting certificates, and again, I'm talking about licensed or registered child care centers, existing centers.
Right. Yes.
If they have emergency certificates, those will be paid based on attendance.
The remainder, at least through the end of May right now, the remainder of certificates will be paid based on enrollment. But the emergency 90-day temporary certificates are paid only on attendance.
And that goes for the CCAIR, the pop-up centers as well.
If they choose to accept vouchers at all, some
Right.
probably will not.
Is there anything a parent needs to do if they're not working and their redetermination falls during the months of April and May?
Again, we would just encourage you to go ahead and get the redetermination done, as Andrea said earlier. You know, it's a benefit for them, because especially if they're working.
But if they're not,
we're not cutting off certificates. We've extended that redetermination period, and then we'll receive an additional 60 days at some point later on to finish that application process.
they don't need to do anything affirmatively,
They
right?
don't. Mm-mm.
Okay.
No. Their certificates won't be cut off. They don't have to send us a letter or do
It'll
anything.
automatically be rolled.
Right, it's automatically told right now.
Until they get their notice, which would be after a determination is made that it's safe to start moving back to normal practice.
I've had a number of comments and questions related to the definition of essential worker, including work that isn't on the list of the healthcare workers and the first responders that were first identified. Can you speak to whether there will be an expansion, and if there is an expansion, when that might occur, of the definition for essential worker?
So let me just first of all clarify that this is, I know that the terminology gets confusing, but for clarity's sake, this is a priority population for the CCDF program. So in terms of essential worker, yes, we pulled these, this list of occupations from a larger essential worker list that our state has used, but we will evaluate this as we go, and it will depend very much on need and demand and funding. So again, our goal was to start small and do it well. And we also felt like it is very likely that a number of the employees, you know, we're also not trying to duplicate something we're already paying for. So that if someone is in a low-income position in a grocery store, it's very likely that they will qualify for a regular voucher, so that one way or another, we will be paying for that child care. Even though the rates are higher for this emergency child care certificate, keep in mind that it's time limited. And so the longer term, more sustainable certificate that lasts a year is probably to the advantage of most parents. So yes, we will be evaluating that system based entirely on demand and need and funding.
I had a question about the receiving and screening requirement. That will require at least 2 staff for each drop-off. What does this process look like at a busy site? What is the guidance for streamlining this process if it leads to logistical or staff ratio issues?
So in the CCAIR manual, which is available at the mdhs.ms.gov/CCAIR, CCAIR, the manual actually provides some guidance for streamlining it. One of the options is you can actually use the area around the parent or guardian's vehicle. The staff members of a emergency CCAIR site or an existing child care, we don't recommend that staff member reach into the vehicle of the parent or guardian to receive the child. We do say the parent can hand off the child to the CCAIR staff member. We do recommend that there be one staff member that actually receives the child, takes them to the screening area just to make sure that the child's safety, that the child, you know, remains safe and within proper supervision. The child is taken to the screening area. The child receives a quick screening, which includes a temperature check and just a visual check for any signs of illness, which can include eye or ear discharge, cough with a fever, irritability, flushed cheeks, you know, things of that nature. If the child passes, you know, there's a green light from the screening, the staff member gives the parent a thumbs up, the child is taken to wash their hands and then taken to their classroom. So you can actually use that area around the vehicle if possible. We have to, you know, it's probably also a good idea for child care centers to let parents know that because of these additional precautions that it may take a little longer to drop their child off in the morning. We understand that people's, you know, the time is precious for people and, you know, people that are rushing to get to work in the morning, but we can't fast forward through this process at the sake of saving time when we're talking about a situation where we're potentially saving lives.
And I want to add one more thing, Carol. I know a couple other states, I was on a call last week, mentioned they were staggering drop-off times. So I don't know if the center's equipped to do that, that might be a suggestion for them, is to sort of stagger your drop-off times to reduce congestion.
And again, remember, we're paying for children not to be at the child care center right now. So we anticipate that while we might be paying for quite a number of children to be there, they are not all there. So, you know, we don't anticipate that they would have their usual census of children to check in.
Will children have to be kept 6 feet apart?
Good luck.
Unless they're on a Zoom panel, yes.
I know, we can't even get 6 feet apart for this.
You know, good luck with that. I would say that's probably not realistic in any form or fashion. And because of that fact, again, that's why the screening process and the additional sanitation guidelines, keeping the group sizes to 10, all those additional things, that are outlined in the CCAIR plan are so important.
And the frequent hand washing and hygiene, I do think, and this is something that if there's ever extra time to work on guidance and suggestions and ideas, we've talked a little bit internally about helping develop songs and games and ways to teach children about the need to be not as hands-on as children typically like to be. We think that there are creative ways that you can begin to educate children, because frankly, this is probably a way of life for some time now, that we will need to be concerned about spread of this virus, potentially for 1 to 2 years. So, I do think that childcare professionals are in a really unique position, because that's your area of expertise to come up with some of those kinds of ideas, that kids might give air hugs, or that you might, come up with songs and small group activities that would emphasize constantly that need to not lick each other. But I do think that I am not good at this. This is not a strength of mine, but I think that people who are early childhood professionals, and that's all of you guys, are you're uniquely poised to come up with ideas like that. And we would encourage you, if you come up with a great idea or a great game, share it back to us and we can put it up on the website. But I think that it's just something we'll all have to use our creativity and resourcefulness to continue to evolve ways to make this work.
And I do want to add to that, Carol, if, especially with the screening processes and other processes throughout the plan, we're looking to improve this plan constantly. It's one of the reasons we put our email right there in the first page. So we are looking for feedback, especially good, constructive, positive, or even negative. That's fine, just to let us know how, once you implement this, kind of some feedback on how that works, or if you have some suggestions for us. So we are open to all of that.
I had a question that makes me think it's important to clarify again. The centers that are currently licensed providers, in order to take emergency certificates, do they have to follow the child care emergency manual requirements in order to take the emergency certificates?
Well, it is strongly recommended, but since they're not going to be additionally inspected, we are relying on child care providers to make good decisions about caring for the children and their programs and their staff and the community that they serve. The guidelines outlined in the CCAIR manual were created to try to keep people safe in a child care setting. Whether child care facilities choose to follow those guidelines or not, ultimately it's going to be, at the discretion of the child care director or the owner. But again, we plead with you to use good judgment. Try to remember that this is a situation, again, where people's lives are at stake. And I know, from my own personal experience, there are people that I know that don't really take it seriously. My grandmother, for example, she thinks it's like a conspiracy and that, the government's just trying to shut things down. But we have pleaded with her. She's 92 years old. And we've pleaded with her to try to be very cautious, not to go out in public, not to be in a group setting. Well, we found out just this past weekend, she went to a house party with her buddies. So, it is what it is. There are people that are using good judgment. There are people like my grandmother that are not using great judgment. We do ask, though, that as child care facilities, that you do take this seriously. And by following these guidelines, you're going to be putting things in place that are again designed to help protect not only the children that you're serving, not only their families, but also you yourself. So take into consideration what you may be exposing yourself to if you're not following, screening guidelines and sanitation guidelines and following these group sizes.
And I would say, I think, the parents will be able soon this week to be able to search for CCAIR trained sites, and that's what they're going to be looking for, is the extra safeguards and precautions, because you now have that designation, so I would just keep that in mind as well.
This is long-term, this is a marketing tool that we're giving to you. And it is, as Christy said, it's something that parents will be looking for. And I think that it's also, if you look at this list of occupations that make up the priority population, our policy decisions about this are recognizing that if you keep children of these workers, you are probably putting yourself at higher risk. So I think it would be, foolish not to implement as many of these precautions as possible. We are not coming out to inspect and see if you're doing it. That's not possible either. So, and we recognize that maybe every single precaution in the policy manual is not feasible. That's where we would like to hear feedback from you all about what you're implementing. If you found a way to streamline a process or come up with a creative way to do something different, communicate that with us. We are not looking to gotcha. We're not coming out and saying you didn't follow the CCAIR manual properly, and so we're taking back your CCAIR certification. But, as Chad said, this is for your own safety. It's for not just your safety, but the safety of any people you go back home and come in contact with. If you take care of your aging mother in your house after you've gone to work all day with children of first responders, I can't imagine why you wouldn't want to follow as much of this as possible.
There's a question about current child care payment program certificates. Are they still being issued at this current time?
We are. We're continuing to process applications. I have all of our staff working remotely, so that business continuity is continued.
But only for parents who are working right now.
Right. It's the
They
same
have to meet
standard.
the work requirement to get a new certificate. Right. So we're not adding additional certificates to be paid by enrollment. They are for children of parents who are working and need open child care right now.
What will happen with certificates that expired at the end of March before this, the announcements came out?
So we had a cutoff date, the deadline in March. If they were expired before then and they did not meet their redetermination, the best I could tell you is go back and reapply. Or if they're part of this emergency group, they could potentially be an emergency certificate holder.
I had a parent that was terminated at the end of March for non-compliance with child support. Is there a way to get her back on a child care certificate?
So if it was the end of March, well, first of all, it's very case specific. So what I would tell you to do is email me the specific, so I can look that case up. And then at that time, I can tell her what happened. I know we've had some that said it's the end of March, but really the parent ended up being, their redetermination deadline had already passed well in the beginning of March. I've had that happen a couple of times. But if this happened past our date, I believe it was, I don't remember exactly, I want to say it was March 16th. We can look at that, and if we've not done it properly, we can fix it. But I encourage you to email me and let me know, or you can email Angela Crockett, our subsidy director.
We did have to have a cutoff date, though, for those certificates that we were going to pay by enrollment, and that's just necessary. So whatever that date was,
I don't have the letter in front of me.
I think it was March 16th.
Yeah.
But if they did not complete their redetermination prior to that, if they lost their certificate prior to that date, then, or wait, after that date.
Yeah. So if you, from that, well, then one has to do the other, but anyway. So if you're in redetermination in March, and the date for the cutoff where we extended redetermination had passed, and your deadline had already passed, then you no longer had a certificate. You are not grandfathered in with this new extension.
So they would need to meet the requirements for either a regular certificate or they would need to meet the requirements for an emergency certificate to be issued a new one right now. And they would need to be actually attending childcare. They would need, so in other words, one of the parents has to be working in a capacity that qualifies for one or the other.
But again, if this was the end of March and it was an error on our part, we'll look at it, but email me and let me take a look at that.
All right. This provider is confused about the issuing of regular and emergency certificates. Will my center be eligible for the emergency certificates once I've completed the training? And will those certificates be paid at the new rate?
Yes, so if you are CCAIR trained and you get your training and you have spots available to take children, you would be available for an emergency, to take emergency certificates. And they would be paid at the comprehensive higher rate for just the emergency certificates.
And I believe you spoke to this, but can you say again, if you are a center that takes both regular certificates and emergency vouchers, will the emergency vouchers be paid based on enrollment? Or did you say they'll only be paid based on attendance while the regular certificates will be paid based on enrollment?
Right.
That's right. Emergency certificates will only be paid based on attendance. Normal certificates will be paid based on enrollment.
Is there a minimum or maximum number of children for an emergency child care site?
Depends on the size of the site.
Yeah.
Same as any regular child care facility. That's going to be dictated by the physical facility.
If there is a positive case of coronavirus and all the children and staff are dismissed for a mandatory period, will that site still receive reimbursement for children?
Regular certificates, they would. For emergency certificates, because they're based on attendance, they would not.
All right. Do healthcare consultants need to be fingerprinted and background checked if they're not on site?
No. If they're going to be supervising children, yes.
How do you transfer a current certificate from a closed center to an open center when the parent can't get the signature of the closed center because they're not open?
That's a good question. I know that right now, when we just started this process, we were working to move that to an electronic format, and I don't know if that got done before the COVID crisis hit. But let me follow up on that, and I'll get back with you, Carol.
We do expect that child care providers be reasonable in this circumstance. We anticipate that we're talking about a limited number of certificates,
Right.
and we're doing our best to honor those child care centers and support them that have made the choice that it's just not safe for them to remain open for whatever reason, but to also recognize that if a parent needs to go to work and their center is closed, they need to be reasonable about allowing that transfer.
I have a current center in one location and I'm interested in opening a pop-up site in another location. Can my current license suffice for the new site?
No, it cannot. That is actually a violation of the child care licensure law. So what this person would need to do is you're going to need to apply to be for the pop-up site. You're going to have to actually go through the full CCAIR site application process. You can't transfer a license from one physical facility to another.
When will parents who are recently terminated be able to reapply for a regular certificate?
Our application process is still open right now. They can go ahead and apply currently.
But they have to be meeting the work requirement.
Right.
And so if they're not meeting the work requirement right now and they know that, should they apply? Like, are we going to hold it in a queue, or is it better for them to wait?
I would wait. I would say that if they're part of that priority population that we've outlined, do encourage them to go ahead and apply for their emergency certificate though.
I want to just say again that I have gotten a lot of comments about the number of parents in low-wage jobs who are considered essential workers under the governor's definition of essential workers, but are not identified as qualifying for the emergency certificates. And there are a lot of comments that are coming in on the Q&A about how important the providers feel it is for those workers, including child care workers themselves, to be included on that list.
Is the concern that they would not otherwise qualify for a regular certificate?
Well, they're just saying that they should be qualified as essential workers.
We're not saying they're not essential. We're just saying they're not in the priority population we've identified at this moment. That could change going forward. But at the same time, we have to gauge, even though we received increased federal funding under the CARES Act, there is one pot of money, and when it's gone, it's gone. So we believe that it's our duty to not only weigh immediate need, but also try to ensure that we maintain some stability in the child care workforce for the long haul. So this is just an effort to balance that. We appreciate, and we are not in any way saying that folks that are not on this list are not essential. They absolutely are. We believe that many of them would be picked up in the regular certification process that they will qualify for. And even though, I know that it's very tempting right now, everybody wants the higher rates, but remember, those are time limited and they're paid based on attendance. So, if you stop and weigh the benefits of one or the other, a long-term certificate that lasts for a year and is paid based on enrollment, at least for the here and now. And let me just emphasize that is something we evaluate on a month-by-month basis. So, it's just that juggling act that we constantly have to do to take a limited pot of money and make sure that we do the most good with it. And that includes stabilizing the child care workforce and also providing for the immediate needs of workers in Mississippi.
What happens to child care after the emergency certificate ends?
So if you're on an emergency certificate and your certificate expires, at that point, you can, if it's not been extended, which means we feel like we're at a point now where we don't need the emergency certificates anymore, then you could apply for a regular certificate through our program if you're still interested in subsidies for tuition.
What percentage of centers in the state have closed?
As of last week, there's approximately 1,500 licensed child care centers. Our last count was at 944 were actually closed.
What should I do if I forgot my password for my Early Childhood Academy?
There's a phone number when you, I don't know if it's on the,
I don't know, but you can contact Early Childhood Academies, contact their coach or go to their website, and there'll be a phone number there you can call. Or if they're having more trouble, you can always call our child care call center number and ask for information or a phone number, and they can give it to you.
How many applications do you have for the emergency child care sites?
As of this morning, we had about 27 sites that were interested. I don't know how many of those were converted to actual sites. That's just how many we had that applied for sites.
I see that we are at 11:50, and I know that you are limited in the time that you have available. We have a few more questions, but what I will do is write them up and send them your way and respond to the questioners as we get answers from your office, if that's okay with you. I know that some people had questions we didn't get to, but we did get to a lot. I want to thank you again so much for making yourselves available for today. We really appreciate the information that you've given. And once again, I'd like to refer everyone on the webinar to the DHS and the CCAC website, where there is a list of frequently asked questions, the manual for becoming an emergency site, information about what qualifies as an emergency site, and the letters, Christy, that you have sent out. We will also link those on the resource page for the mschildcare.org site. Again, I want to remind everyone that this webinar's recording will be available so you can go back and review it. And if you have any questions, you can reach us at info@mschildcare.org. Thank you all for participating.
Thank
Thanks so much.
Goodbye.
Bye.
Bye.